Okay, so we're gonna go through how to do an ultra bag exchange. You'll want to check for seal, which is the strength, expiration amount, and for leaks. Strength is located 2 different spots. One is along the side and the other is in the top. The amount is always at the top left along with the expiration. And leaks, you'll just want to squeeze it and make sure that there's no leaks. So we'll hang our bag on the IV pole. And you can just rip it apart. This is your fill line and this is your drain line. We're gonna start with a clamp on the fill line. I'll have my mask on and I will wash my hands prior to the procedure. I'm gonna grab the line that connects to the patient line, kind of like this. I'm gonna pull off the pull ring. This is now sterile, so we do not want to contaminate this, which leaves me my forefinger and my thumb to remove my cap, to keep my patient line sterile, and to connect. There's gonna be a little bit of iodine that might come out, so don't be alarmed. We're gonna break our frangible. The more you move it, the farther apart it is, the better it'll drain. We're gonna open up our transfer set, the baby blue and white. You should be able to see the solution starting to flow into the drain bag. Draining will take approximately 15 to 20 minutes depending on the person. Some patients will go quicker. Okay, now that my belly is completely drained, some patients will state that they have some sort of cramping or pinching. Males might feel a little bit of a pinching around their scrotum. Women might feel like it's a menstrual cramp, but either way, if it's done, you should be able to lift up the bag and see if there's any draining coming out or not. Once I'm complete, I'm going to break my frangible, or I'm going to close my transfer set, baby blue and white. I'm going to break the green frangible up at the top. I'm going to remove the red clamp and count to 5. 1, 2, 3, 4, 5. And clamp it off. This will prime the line because there is air in here. So it'll prime the line so there's solution throughout, so we know that there's not going to be any air in the patient's abdomen. Once I've primed, I'm going to open up my transfer set, my baby blue and white, and let it fill. Now that my fill is complete, you can see that even though the bag is empty, the fill will only stop at a certain point in the line, so you'll never fill the patient's abdomen with any sort of air. So if you were to leave and come back, it's okay, it'll just sit there. So we're going to clamp our fill line. And we're going to close our transfer set, which is the baby blue and white. We'll perform hand hygiene and apply gloves. We will prep our mini cap. At the bottom there is an expiration date, so you want to make sure that it's not expired. So when we disconnect, this is dirty, we don't care about this, we'll just throw this away. We'll look inside our mini cap and make sure it looks moist. If it looks dry, get a new one. And we'll arrow it on to the tip of the catheter and tape our catheter down. No kinks, because that'll cause a crack, slit, or a hole in the catheter. If you notice something is goofy with the catheter, please use one of those red clamps closest to the body as possible and call the doc and the dialysis nurse on call. When the ultrabag procedure is complete, you'll want to weigh the drain bag on the fish scale. When you look at the fish scale, it looks like it's at about the 1900 mark. So you'll want to chart that in the flow sheets that it was 1900 with a negative UF of 100 because we did not get the full 2 liters out from the previous exchange. If it is positive, let's say 2500, you'll want to chart that it was a positive UF of 500.